Hi everybody, this is Amanda Criswell, your course coordinator, and I wanted to do a quick demo for you about your clinical project PowerPoint that you will submit, and really about your clinical project as a whole. If we start by just thinking about what evidence-based practice means in the world of nursing, the clinical project will make a whole lot more sense. So we can easily figure out how clinical research has told us how many days an indwelling catheter can stay in and not cause an infection. Sometimes we struggle more when we get to an abstract thought process like the world of management, hence the class that you're in right now. So as we look at management and we think, how do we apply evidence-based practice to management? That's what this project is designed to demonstrate, that you have an understanding of how that happens. You encounter problems in the world of management just like you do in the world of bedside nursing. And it's important to understand, as an evidence-based profession, we have resources to pull off of to help us through those problems. So let's click through a few slides here just so I can show you. The clinical project, the first thing it says is to talk about an opportunity identification. So that means a clinical problem, a staff need, an organizational issue, whatever you and your preceptor have identified as being an issue in your facility. So on this clinical project that I'm going to show you the example over here, it's about skin to skin. So the opportunity here was this hospital is trying to be the first baby-friendly designated hospital in the Jackson area. An immediate skin-to-skin contact is a piece of that baby-friendly criteria, and the hospital's not been able to achieve it. So that's where the problem is and why it's a problem. So then we can click back and see the next step would be to assess. So the student would assess all components of the identified opportunity. What are the components that contribute to the factor or influence the opportunity? So let's click over and see here. As we look at what the assessment was for the skin to skin, we can see it's typically delayed as the result of medical treatment or procedures. And these procedures are typically or historically completed within the first hour of life. So weight and length of the infant, vitamin K, bath of the infant, any painful procedure. Those things you typically think of a baby getting when they're first born. The delay occurs, so basically we've put it now into three categories. Family traditions and curiosity, so the family wants the baby to be clean and the family wants the baby to be weighed. Task-focused nursing, which is where nurses are wanting to assess the baby and put them on the warmer, get their APGAR scores, get them all tucked in so that they can go do their other business. And then physician habits as well, where the doctors, same concept. Doctors are accustomed to being able to get everything done and walking away, and now this slows the process. So those are the three big issues that this nurse has identified in the assessment as being a problem. So then we click back over to our instructions and we say diagnosis is the next step. And then this step is simply what specific component of this problem are you going to address, or what's the goal. So you can't do a project on addressing family traditions, task-focused nursing, and physician habits all in one. It's going to have to be tailored down or summed down to a manageable level. This is true when you become a manager. You'll see a problem has many facets to it. You can't address all facets at once. You have to pick them apart and pick the most important ones to you. So in this scenario, they decided to address the nurse. And so the goal here was that the nurse would initiate skin-to-skin contact with 2 minutes of the birth time. So what they're actually going to try to change is this task-focused nursing and move it to getting them to put the baby on the mom's chest. So then we have a plan. So the plan happens in two parts. First, you'll see it says complete a review of research, and then a second it says identify a plausible solution. So first we'll look over here and we'll see the plan or research review. So she has three different places she looked. She went on the baby friendly website. She went to a website called Ready, Set, Implement, and then she found an article out there about 5 steps to improving regulatory compliance and quality at your hospital. Because what she very quickly discovered, this nurse did, was that the education had been done. It was a compliance issue and not a lack of knowledge. So that's why she shifted gears and decided compliance might be a better thing to search for. So there is her review of research. The second over here, it says, identify a plausible solution for the component identified and develop a plan for execution. So what she found when she read that 5 steps to improving regulatory compliance was that she wanted to utilize schedule and complete ongoing provider performance evaluations as the tool to help her achieve her goal. And so she created a chart audit tool and schedule to implement. That's her plan. So the implementation, when you get to this phase, it says here that the student will identify tools and resources needed for plan implementation. So here she put a general, very broad steps for implementation. So I need to create the chart audit tool and an audit schedule. Then it's develop consequences for lack of compliance. Then educate staff about impending chart audits. So then she identified over here the resources she would need. So to create the tool, she thought that the baby-friendly committee or the project lead would be a good person to help her with that. To develop the consequences, she thought managers would be the right place to go for that. And then for education, she went to the educator for that. Makes perfect sense. Then we have an implementation review. And all the implementation review is you take this plan to your preceptor and have your preceptor look at it and let them make suggestions for improvement, tell you what might work and what might not work. Now this nurse actually also included an example of her skin-to-skin audit tool. So this is what she's saying would be the tool she would utilize. So after her implementation review, you can see down here it says preceptor recommendations were to add a go live date to the role of the manager and to be included in the go live date, and then consider education for the physicians about the chart audit tool as well. So maybe we need to consider educating physicians, in which we would add another step down here. So those were the suggestions that she had. The last piece is the evaluation. How will the student identify how the plan, if the goal was achieved or the plan worked? And the evaluation is really very simple. It typically comes from the same thing you've been looking at. So if you have, for example, a report at your hospital that told you CAUTI was a problem, that report you utilized to know it was an issue is the report you're going to go back to see if it worked or not. Now, you're not actually required to implement this plan. We're only asking that you look at the steps to implementing the plan, consider everything, and then how you would evaluate it as a manager. So this doesn't have to be a real number. This is more of a what would you look at if you had implemented this. So in her scenario, they're going to utilize the chart audit tool to determine the effectiveness of the goal. And that is the end of that project. That's how easy it was. It was 11 slides total for her presentation. So let's go back over here and look real quick at, I know why that's doing that. Let's look at the rubric compared to her presentation now. And we'll look at the first point on the rubric says the project title and participants. So the student identifies the project title, she called it Skin to Skin, and the participants. So the participants here are the nurses at the Community Women's Hospital in the Metro Jackson area. So she did meet that criteria. Next is the assessment findings. The student assessed all components of the identified opportunity. So we look over here and we see that she did a good job here addressing or identifying all these different factors. So we would say yes, she did identify multiple opportunities here. Next is the diagnosis or goal. So the student identifies a specific component of the clinical project to be addressed. And that is exactly what she did. She said the nurse is going to do this within this X amount of time. So yes, she's going to meet that one as well. Then the next one is plan. The student completed a review of research. There's her review of research. And the student completed a review of research and identified a plausible solution for the component identified. Did she do that? Absolutely. Did she use the research to execute the plan? She did, because she created a chart audit tool that looked at schedule and complete ongoing provider performance evaluations. That's exactly what she did. Okay. Then we move to implementation. It says the student identified tools needed to implement the plan. Yes, she did. That's what her resources are over here. Those would be her tools needed. Implementation review is next. In the implementation review, it says the student reviewed the plan with the preceptor and included the preceptor's suggestions. So she did that right here when she included this slide. And then finally, the student identified how the plan will be evaluated. And this is simply how the plan will be evaluated. So she has met all of the criteria for the clinical project and would successfully complete this. I hope this clears up any confusion that you may have, and I hope you find this to be an interesting and beneficial project. Thanks, and you guys have a great day.